Hi, this is Cheryl Gallant, your Conservative Member of Parliament for the medically alert riding of Renfrew-Nipissing-Pembroke. The Liberals are scamming rural Canadians again. Trudeau recently announced he would double the rural supplement as part of his climate bribe. Then the Liberals turned around and cut off thousands of Canadians from receiving the rural supplement. Residents of Arnprior and McNabb Braeside are no longer eligible to receive the rural supplement. The reason they're being cut off from additional supplements to the carbon tax rebate is because they're commuting longer distances. Thanks to Trudeau's reckless inflation-fueling spending, Canadians can no longer afford to buy a home in a major city. They're forced to move outside the city to find affordable shelter. Then they are forced to commute into the city. So many people have moved to Arnprior in order to work in Ottawa that the government considers Arnprior to be a part of the Ottawa-Gatineau census metro area. The longer drive means they spend more in carbon taxes. But the fact that the Canada Revenue Agency can deny these people the rural supplement only proves the box forcing people to opt in on their taxes is a scam. It's meant to reduce the number of people who receive the supplement. So if you check the box but don't live in a rural area, CRA will deny you the supplement. If you don't check the box but do live in a rural area, CRA will stay quiet and deny you the supplement. It's another Trudeau coin flip. Heads he wins, tails you lose. One of the reasons I still do this Facebook Live show is because the legacy media will often completely ignore an important issue. On the rare occasions when they do cover an issue, they reduce the coverage of a complex situation to a black and white cartoon complete with heroes and villains. Last fall, the CBC tried to paint anyone who criticized the World Health Organization's proposed pandemic treaty as evil, stupid people who push conspiracy theories. Many of the early critics of the proposed pandemic treaty were people who had been directly impacted by the different public health policies put into place during the pandemic. Some of them were people who lost their businesses and entire life savings due to lockdowns. Others were injured by vaccines, or the people they loved were hurt. Others lost jobs or were barred from public life because they were reasonably concerned about a brand new, never before used, leading edge biomedical technology. Now, collectively, all these people were branded as heretics by the legacy media. One media outlet, the Toronto Star, even suggested they should all be killed. While most Canadians want to move on from the pandemic, for those whose lives were absolutely destroyed because of unscientific public health policies, moving on isn't really an option. That's why these Canadians have been so concerned about the World Health Organization's push for a new pandemic treaty, as well as making changes to the international health regulations. Yet their concerns have been ignored by the media, who have essentially decided to support the treaty process by not reporting on it. Last week, the World Health Organization's Assembly of Nations met in Zurich to finalize the new treaty and pass the new regulations. Except the 192 nations failed to reach any agreement. The head of the World Health Organization is trying to blame the vaccine skeptics for pushing disinformation about the treaty for his colossal failure. That is a big fat lie. Not only is it a lie, but it's the exact opposite of the truth. The world's countries failed to reach an agreement over giving the WHO the power to seize up to 20% of a country's supply of vaccines. They want to take vaccines from democracies and give them to corrupt dictators, all in the name of equity. Countries such as Britain and the United States oppose this type of vaccine socialism. Countries such as China and Iran are demanding vaccine redistribution. The government of Canada has been noticeably silent on the issue, probably because under Justin Trudeau, Canada engaged in the kind of shameful vaccine hoarding which led other countries to demand this new treaty be all about vaccine redistribution. If this treaty were to pass as is, the most likely result is that during the next pandemic, the public is going to have to wait 20% longer to receive a shot. Now, for those Canadians who the media like to paint as anti-vax villains, this treaty failing because of a dispute over who gets vaccines is ironic. But for the head of the WHO to blame them for the treaty's failure to secure passage is pathetic. Now, the trouble for the legacy media is that they've been writing off critics of the treaty as bad guys, yet when the treaty fails because countries' leaders are worried they might not be able to get the next vaccine fast enough, it causes a short circuit in their media brains. Now, just because the treaty and the changes to the international health regulations failed to pass at this World Assembly does not mean it's dead. Far from it. The WHO will continue to push for more powers, but now is an opportunity to have a real healthy debate about how to best prepare for the next pandemic while learning from the mistakes and the abuses by all levels of government during the last one. Up until now, everything about this treaty process has been a failure. Canada hasn't even had a fulsome review of the government's actions during the pandemic. Yet the technocrats already have the answer. More power for governments and the WHO. Both the proposed treaty and proposed regulations are being advanced as a part of what the public health establishment are calling a One Health framework. Canadians can see firsthand what the One Health approach looks like with Bill C-293, an act respecting pandemic prevention and preparedness. The bill proposes to give the Minister of Health vast powers over agriculture and the environment. For these technocrats, One Health means the health of animals and the health of Earth. The bill would give the minister the power to shut down any farm in Canada. The radical left is opposed to livestock farming. They want everyone to go vegan or eat crickets. So instead of persuading Canadians to make the switch voluntarily, the far left will seize a pretext. Now, before the pandemic, the pretext to shut down livestock farming was climate change and the danger of burping cows. Now, the pretext is pandemic prevention. We know this is all a pretext. The concern is pretend because of what is not in the bill, or the proposed regulations, or the treaty. And that is anything to do with the most likely source of the pandemic, a lab in China playing around with coronaviruses. The Liberal bill and the China-controlled WHO are completely silent about the threat posed by lab accidents or bioweapons. That's because they can't use it to expand government power. If anything, it addresses biosecurity calls for more constraints on governments, more accountability, and more transparency. Canadians need only look at the Liberal cover-up over the infiltration of communist agents at our country's most secure biolab, or the cover-up in the United States over funding to the Eco Health Alliance, who funded work at the Wuhan Virology Institute. Whether or not those cover-ups were connected to the last pandemic is not the point. The point is that at the very intersection of biology and national security, Canadians were left in the dark. We now know the Liberals tried to cover up the scandal at the Winnipeg lab, not over national security concerns, but because it made them look incompetent. Now, the best way to prepare and prevent the next pandemic is not to give unlimited power to the Minister of Health. The best way is to improve transparency, accountability, and competency. Live from Ottawa, this is Cheryl Gallant.